So now let's turn to the most talked about question. Does Tylenol use in pregnancy increase the risk of autism or ADHD in children? And here's the recent summary from Medscape, and I'll place the link below in the description. So for years, some studies suggested that there may be a link between acetaminophen use in pregnancy and conditions like autism or ADHD in children. And this sparked major public concern and even lawsuits in the United States. Parents claimed that companies selling Tylenol should have warned about this risk. But in 2023, a federal judge ruled that scientific evidence was too weak and those lawsuits were dismissed. So what does the actual research show? A 2024 Swedish study of 2.5 million children found no causal link once they adjusted for genetics and family history. A 2025 review of 46 earlier studies did suggest that there could be a connection, but experts from Mount Sinai and Harvard were clear this does not prove that Tylenol causes autism or ADHD. The studies only showed associations, which may be due to other factors. Large studies from Europe and Japan also show that the small associations people see may actually be explained by co-founding factors, things like mother's health, other medications, environmental exposures, or genetics. So the bottom line so far, there is no strong proof, actually there is no proof that Tylenol causes autism. Experts still recommend it as a safer option for pregnant women, but at the lowest dose and for the shortest possible time. So if there are questions about Tylenol, if there's still debates, why is it still recommended in pregnancy? Because untreated fever is also very dangerous. High fever can increase the risk of birth defects, preterm births, and miscarriage. Severe pain and fever can also harm the mother, causing dehydration, high blood pressure, and other problems. So why isn't ibuprofen or aspirin recommended for pregnant women, you may ask? Well, NSAIDs like ibuprofen are not recommended in the third trimester because of the risks to the baby's heart and kidneys. And that's why organizations like American College of Obstetricians and Gynecologists still recommend Tylenol as the first choice for pain and fever in pregnancy.